All right, good afternoon, everyone. Thank you for joining us today. On today's briefing, we'll hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management, Commissioner Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department, and Tim Sheehy, President of Metropolitan Milwaukee Association of Commerce. Thank you all for being here, and County Executive Crowley, we'll start with you today.
Well, thank you so much, Catherine, and good afternoon. I hope everyone had a chance to enjoy a Memorial Day weekend and enjoy the wonderful weather that we also had. So today is the day of transition and another step forward in the right direction as we continue to fight the COVID-19 pandemic. And as cases continue to decrease locally, the City of Milwaukee Health Department, their order expires today, and the county announced that within CDC guidelines that masks will no longer be required outdoors on county property for individuals who are fully vaccinated. However, as we get used to this new normal order, I want to remind folks that Milwaukee County is still requiring fully vaccinated and unvaccinated people to continue to wear masks in indoor settings in our Milwaukee County facilities. And we know that the risk of transmission indoors is significantly higher. And we want to ensure that our services remain accessible and safe to all members of the public. But as well, over the last few weeks, we've all probably had breathe some fresh air, some sighs of relief, as we've been able to engage in more activities and some of our favorite activities and patronize more businesses. So I can personally say that I've had a chance and enjoy getting together to see some family, hug family and friends that I haven't seen in a while. And it does feel good to be with people again, to make plans and for their kids to be with some of their friends as well. So it's easy, I will say, to let our guards down and completely resume life as it was before COVID, but we can't get too far ahead of ourselves. COVID is still present in our community, and this virus is still a deeply and imminent threat to all of us. So even if you are vaccinated, but especially if you are not, continue to respect spatial boundaries. Wash your hands regularly, avoid crowded spaces when possible, and wear a mask in close proximity with others. And we are encouraged as we reopen safely that we continue to see vaccination rates trending up and infection rates trending down. But please remember, again, this is not over. So let's stay safe and keep continuing to follow the safety measures that's going to keep us all protected. And even if you got a chance to get out with other folks, we know that testing is another tool that we must continue to use to fight against COVID-19. So COVID testing sites are still widely available in Milwaukee County. So if you gather with people from multiple households to celebrate the long holiday weekend, please do not hesitate to get tested. Testing is still one of the best ways that we can monitor our health and protect our loved ones. And in Milwaukee County, it is free, quick, and convenient to get tested. And so you can find resources or a list of testing locations as well as vaccination locations by visiting healthymke.com. And then lastly, I just want to reiterate a really important message. I had the pleasure of sharing yesterday morning with Mayor Baird as well as Superintendent Posley. And so Milwaukee County, we have many summer youth employment opportunities, including hundreds of seasonal positions with the Milwaukee County Parks, as well as our zoo. And so in addition to these positions, the Milwaukee County Department of Health and Human Services, they have developed their very first ever youth employment program. And as part of the program, every young person will receive vocational support, paid employment, but they'll also be able to explore and build positive community connections, making sure we're helping them to build relationships, build job readiness skills for their own future, explore, but also build purpose, aspiration, and their own personal goals while helping them to develop meaningful roles. And so our young people were one of the groups that were impacted hardest by COVID. And we feel that these opportunities are setting up our young folks up for future success by connecting them to the jobs that require them to structure their time, have a sense of accomplishment, but I know many of them would just like to put some money in their pockets so they can get a paycheck. So something many people did not have the chance to do last summer because we had closed down because of COVID. So if you know any young people that are looking to apply, all they have to do is visit milwaukee.county.gov or type in Milwaukee County careers with the parks in whatever search engine that you use. So please, if you know anyone who's looking for summer employment, please have them reach out to Milwaukee County, the city of Milwaukee, or employ Milwaukee as well. With that, I want to say thank you for joining us and hand it over to Mayor Barrett. Mayor Barrett.
Well, thank you very much, Mr. County Executive. I'm having some technology problems today, so I hope I'm coming through to them here at City Hall. But I'm going to forge on with maybe with somewhat hampered technology here. But I appreciated the opportunity to be with the county executive yesterday. And I think what you saw yesterday is you saw the city, the county, the school district, all of us recognize that we have a special opportunity this summer and a special responsibility to make sure that we're doing everything we can for the young people in this community. And so whether it's Jobs in Parks, whether it's our Earn and Learn program, whether it's the City of Milwaukee Public Schools playgrounds, there are going to be a lot of activities for young people. And this is in large part due to the help that we're receiving from President Biden and the Biden administration in helping us create these jobs this summer. So we're very thankful for that. Tomorrow, I'm going to be doing something a little out of the ordinary. Each year, as some of you may know, I do a State of the City speech. Given all the challenges that we have had both last year and this year we are not having a traditional State of the City speech. But tomorrow at noon, I'll be releasing a reflection, a year reflection, where we've got some residents of our community, as well as myself, talking about some of the challenges that we have faced over the last year. So that will be released tomorrow, and we're looking forward to that. But I think the big news for today, I think, as we all recognize, is that now we're in a new phase of recovery from the pandemic, and a lot of the restrictions have been lifted. The city of Milwaukee will continue to support those businesses that are continuing to require masks in their private establishments. And the city of Milwaukee as an employer will require masks in its public spaces of City Hall and other places like that. But by and large, it's a new phase of the recovery, and that's good news. At the same time, we must be mindful that the pandemic has not disappeared, and every day or two, we'll get a report from the medical examiner about another death. So as much as we all want to enjoy this summertime, and it's a glorious day today, the fact of the matter remains that we still have an obligation to do everything we can to eliminate this pandemic. And to that end, although we have closed the Wisconsin Center as of last Friday, we continue to have the community sites open at the Northwest Health Center as well as the Southside Health Center. And I think that vaccinations are very, very, very available right now. And we know we're going to continue to make progress if people will continue to get the vaccination. The numbers have been rising, but we continue to see disparities, age disparities. A lot of the younger people are not receiving them. I think for those of us who are over 50 or over 60, you're seeing really, really good compliance from people of all racial backgrounds. But at the younger ages, we're not seeing as many people stepping forward, and we want to see that happen. So we'll continue to be going to the community sites. We'll have over 200 what I would call pop-up events, and events where we're working with church groups or community groups or young people to get shots in the arms. But we're continuing to do the work that we started just several months ago. So again, it's a good day in Milwaukee. The sun is shining. A lot of the restrictions have been lifted, but we still have work to do. And so with that, I'm going to turn it over to Dr. Weston. Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First, to our numbers, we're currently seeing in Milwaukee County an average of less than 50 new cases a day and about 1 death every 2 days. As we continue to see an influx of children as young as 12 seeking out vaccine in our community, many families are left wondering how they should proceed in a society that's opening up more and more when they have children younger than 12 who cannot yet receive the vaccine. So first, it's important to know that vaccine is coming. Studies are ongoing in children as young as 6 months old, and I expect that the vaccine will be found to be highly effective and extremely safe in all of these age groups, as it has in every other age group. So hopefully later in the summer, we'll receive good news on the expansion of the vaccine to younger and younger age groups. However, that still leaves a summer of activities and gatherings to negotiate with young children. And when considering young children and COVID, 2 questions likely come to mind. First, what is the level of risk? And second, how can we protect them from the risk that does exist? So to the first question, what is the level of risk from COVID to children? Now, children of any age can certainly contract COVID. Most have mild symptoms, including fever, cough, fatigue. Some rarely have more severe symptoms in the short term. particularly those with underlying health conditions. Now, one complication of COVID infection that's specific to children is multisystem inflammatory syndrome in children, or MISC. And this is a life-threatening combination of inflammation to different parts of the body. It can include the heart, the lungs, the brain, and the kidneys. Now, in addition to this, and what I find particularly worrisome, are the unknowns with the COVID virus. There's frankly much we still don't understand about this virus. Among those unknowns are, why do children tend to not get as sick in the short term? What exactly causes that MISC complication? And key, what may be the long-term effects of COVID infection in children? As a comparison, we see in young adults that 1 in 4 have long-term effects from COVID, whether it's headaches, body pain, fatigue, breathing difficulties. And we don't yet know in children what long-term effects may result from this virus and how that could affect them in the future. Now, many people may respond that we also don't know the long-term effects of the vaccine. And while yes, we can't guarantee the long-term effects of this specific vaccine, as it's not been around for years and years to study, we can look at decades of vaccines, different vaccines, and understand that the safety of vaccines are very well known. Side effects show up in the first couple of months of vaccine usage, and there's no reason to expect any long-term side effects from this vaccine. Now, that's not the case with the virus, where we know of many viruses that cause long-term, often debilitating effects. So with the understanding that there is a level of short-term as well as long-term risks from children getting infected with the COVID virus, how can we protect our unvaccinated children this summer? Now, until we get children under 12 vaccinated, the principles are the same that we've been following for quite a while. Our kids need to socialize, certainly. They need to participate in learning and sports and group activities. And they can do all of these, but they can do them safely. So with the warmer weather, these activities can often take place outside, where transmission of the virus is far less likely. And generally, it's safe to not have your child mask up outdoors. Though in situations where distancing from others is difficult, you may still consider having your child wear a mask. Now, on the other hand, in public indoor spaces, such as stores or other gathering places, it can be a bit more challenging, especially now that mask restrictions are being lifted, and it's hard to know whether the person standing next to your unvaccinated child is vaccinated or not. So certainly having your child wear a mask when in these less controlled indoor settings is going to be important. And for many where the option's available and convenient to leave the children at home during these short outings, not taking them to these more crowded indoor settings until they're fully vaccinated could be considered as well. In the end, we must continue to be cautious with anyone who's unvaccinated, including children who are less than 12 and can't yet get vaccinated. Keeping them safe will not only prevent the possibility of acute disease in them, but also the known and unknown long-term side effects, as well, of course, as decreasing community spread. And we'll all certainly look forward to the expansion of vaccine availability to younger age groups before the weather starts cooling down again and we all head back indoors. Thank you very much. Stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. As of today, the Moving Milwaukee Forward Health Order and mask ordinance have expired. Gathering limits and mask requirements will no longer be enforced by the City of Milwaukee Health Department. We trust our businesses and community partners will continue to take appropriate measures to keep their staff and customers safe. And we remind everyone to be respectful of safety protocols that may be asked of you. We recommend everyone, regardless of vaccination status, continue to carry a mask with you. Some buildings and businesses and all public transportation may still have masking requirements. In addition, if you're not fully vaccinated, meaning 2 weeks past your second dose of Pfizer or Moderna, or 2 weeks past your single dose of Johnson & Johnson, you should continue to wear a mask when you're in public with people outside of your household. I am confident lifting these restrictions today because of the work our community has done to reduce the number of positive COVID-19 cases over the past 15 months. The data today shows the City of Milwaukee's 7-day burden rate has dropped to 33.9 per 100,000 people, putting us in the moderate transmission category. As a comparison, only a month ago, our burden rate was over 110 per 100,000. This exponential decline is proof of the success vaccination has on moving us forward. Our test positivity rate is 2.5%, and hospitalizations in Wisconsin are the lowest they've been since we started to collect and track COVID data. As of today, 49.5% of Milwaukee adults have received their first vaccination, and that number continues to climb every week. There's enough vaccine for anyone who wants it, and vaccination opportunities across the city. In addition to the upcoming vaccination clinics the mayor mentioned, the Milwaukee Health Department continues to provide vaccinations Monday through Friday at MPS schools and Milwaukee Public Libraries, as well as the Northwest and Southside Health Centers. The weekly list of all vaccination sites can be found at milwaukee.gov/COVIDvax. As announced last week, the health department's teaming up with Summerfest this weekend for a drive-through vaccination clinic. This is the first drive-through site the health department has offered, and we hope the convenience and ease of getting vaccinated, along with the incentive of a free Summerfest ticket, will bring many residents to Summerfest grounds this Saturday or Sunday between 10 a.m. and 5 p.m. Black Husky Brewery is bringing back their vaccination site this weekend from noon until 6 p.m. on both Saturday and Sunday. They will have both first and second doses of Pfizer, as well as Johnson & Johnson. Just like their last event, if you're already vaccinated and bring your unvaccinated loved one to get their shot, you'll both receive a free beer. We at the health department are incredibly appreciative of the businesses, community organizations, events, and places of worship who have worked with us to vaccinate Milwaukee. Vaccinating Milwaukee is and will continue to be a community-wide effort. If any organizations or events are interested in offering a vaccine clinic, please reach out to the Milwaukee Health Department at 414-286-6800. Thank you.
Thank you, Commissioner. And we will now hear from Tim Sheehy, President of the Metropolitan Milwaukee Association of Commerce.
Thank you. Good to be with you. I thought I would share some results from two surveys that we did. One is a board survey of roughly the 75 largest companies in the region. And the other is a survey that we've recently completed in a line of, it's actually the sixth one going back to May of 2020 on data that really looks at two aspects of this. So one is consumer confidence and the other is employee safety. And as we look forward, as we've looked backwards at COVID, as we look forward, those two things are really important to getting our economy back on track safely and making sure that people return to work for those jobs that require that. So in looking at the data, we found that 41% have more than half of their, 41% of the companies have more than half their employees working remotely, and 71% have more than 25% of their employees working remotely. When asked about a return to work, 39% of those companies we surveyed saw their workforce returning after Labor Day, and 61% saw most of their workforce returning before Labor Day. So I think we're on the front end of this ramp up as people continue to return to work. And one of the reasons this is important is when we look at the downtown, roughly the downtown Milwaukee area, there are 91,000 people working in downtown Milwaukee. And so if you apply just what I put against that, and you think about a quarter of those are now back in the office, you can see the potential, the impact it's currently having on our economy downtown, and what's going to happen as people start to return to work. And so that will be an important milestone as people start to return to work and what that means for turning on the economy in a whole host of ways. And when we think about that, we think about, again, consumer confidence. And so if you go back to February of 2020 and look at 60% of the 1,000 or so residents that we surveyed across the state of Wisconsin felt comfortable going to a hotel or using a hotel, that's now climbed from 60% to 82%. If we look at those who were comfortable going to a movie a year ago, that was at 45%, it's now climbed to 70%. Going out to a bar has gone from 44% to 64%. And eating out at a restaurant has gone from 63% a year ago to 83%. So clearly consumer confidence is returning. It's returning, quite frankly, a bit faster than people can find employees and get them ready to handle those returning consumers. When we look at what's going to happen going forward, 17% of employers are going to have work, full-time work remote. So people, 17% of their workforce, or 17% of the companies, excuse me, that responded are going to allow some people to work full-time remotely. 59% are going to allow people to work remotely 2 to 3 days, and 67% are going to allow some flexibility. So clearly more flexibility, more remote work than we saw going back. And I think some of that is going to be baked in permanently. And then the final thing I want to touch on is, again, comes from the survey, which we've done 6 times over the past year with roughly 1,000 Wisconsin residents. And about 47% felt employers should be able to require a vaccination. 43% felt employers should not. So there's clearly a split there. I don't think most employers are going to require a vaccination. And of those that responded to the survey, 61% had been vaccinated, 37% had not been vaccinated. But what I found interesting in the not been vaccinated portion is that of the 37% who said they hadn't been vaccinated, 14% thought they were going to do so soon. Another 23% were going to continue to wait before they got vaccinated. And 40% said they definitely would not get vaccinated. So this is a little bit out of my purview, but as I see people returning, I think we're seeing a bit of a plateau in the number of people getting vaccinated. So I would just back up, which was what was said before me, that vaccination is going to be a continuingly a critical part of both consumer confidence and employee safety. So Catherine, I'll leave it there.
Excellent. Thank you, Tim. Our first question from Rose Schmidt with CBS 58 actually dovetails nicely off of what you just shared, Tim. And she's asking whether you have comments or the mayor or the health commissioner. She says, outside of businesses that are continuing to require masks, do you have a sense of other places in Milwaukee where people will still have to mask up?
Again, our approach is going to be that we're going to be supportive of those businesses and organizations that feel, based on their knowledge of their clientele or their employees, that it's appropriate. So we're going to continue to support them. But I think we all recognize as time goes on, and if these trends continue, hopefully at some point we'll be able to back off from that as well. But I think we're still in short range decision making for a lot of these things, but we want to make a clean transition to our new order, and that includes being supportive of those businesses that will require masks. Now, that doesn't mean that we're going to come in and have an enforcement mechanism. So it's more, we're back more at the very beginning where it was more education than anything.
Yeah, and I just backed that up. There are 3 things you want to carry with you: your car keys, your wallet, and the mask.
That's excellent. Thank you both. The next question, portion of Rose's question is for the health commissioner. She's wondering what percentage of the city is vaccinated, both 1 dose and fully vaccinated?
Sure. So 16 and older, 42.5% of adults in Milwaukee. So anyone over 16 and older, 42.5 are fully vaccinated and 49.5 have received their first dose.
Thank you, Commissioner. The next question is from Victor Jacobo with CBS 58, and it's for Dr. Weston and others. The Wisconsin Hospital Association is reporting its lowest number of hospitalizations statewide since they started recording that number during the pandemic. What is your reaction to that milestone, and what will help keep that downward trend going?
Well, it's a welcome milestone, an important one, and it's similar in Milwaukee County. Today, we are at the lowest number of hospitalizations we've had in Milwaukee County related to COVID since the beginning of the pandemic. So it's part of the continued trend we're seeing of a decrease in disease burden. And we know why that decrease is. It's because of vaccinations. It's because more and more people in our community continue to go out and seek vaccines and protect themselves as well as protect the community. And we're seeing it in the numbers.
Excellent. Madeline Anderson with Fox 6 is wondering, for anyone on this call, what message do you have for younger people who don't think they need to get vaccinated, especially as mask policies and other restrictions are going away?
Well, I would say that, don't let your guard down. It's extremely important that as many people get vaccinated as possible. And I know many young people are looking to go to the mall, want to be able to enjoy going to the movies and any other the entertainment that we have to offer. But in order for us to safely do that as a community, we need as many people to be vaccinated as possible. And so again, you can always go to the healthymke.com website to find as much information as possible. But just know that this vaccine is one of the best tools that we have right now to eliminate the problems that we've been having for the past year and a half.
Thank you, County Executive. Our next few questions come from Allison Durr with Milwaukee Journal-Sentinel. The first one is for Commissioner Johnson. She says, it appears the city hasn't issued citations for violations of the mask ordinance or the COVID health orders since late April. Are you able to explain why they stopped so abruptly?
Absolutely. Our inspectors have continued to go out up and through this last weekend. We had inspectors that were out doing, following up with complaints and also just doing investigations. There is a process. So between the time that the investigator goes out and identifies an issue, the citation comes back to the health department, we review it, and those who are only the most egregious offenders would have received a citation. So we look at the violations very closely internally before citing anyone. So there's a bit of a lag, but we've also really put a heavy emphasis on education, knowing that we're moving out of the phase of enforcement and into with lower case numbers, moving Milwaukee forward, really focused on education and helping operators do what's most safe in their environments.
Allison's second question is for the commissioner, the mayor, and Tim Sheehy. The city has issued more than 250,000 in citations to businesses for violations of the COVID-19 health orders and mask mandate. What's your reaction to that figure? How effective or not effective do you think enforcement efforts, including the potential for citations, have been?
So I can start with that. I do think that initially our citations and the threat of a citation, that violations that were being enforced, it was effective and has been effective in businesses asking people to mask and enforcing social distancing. Certainly, I think there have been some bad actors and that's been a little bit more challenging, but by and large, the vast majority of our businesses have been tremendous partners in making sure their spaces are safe for their patrons.
And I would concur with that. We saw tremendous cooperation from businesses throughout the city of Milwaukee. And those who did receive the fines, I think many times, if not most times, or not all times, were very flagrant in their disregard. And remember, most of these fines were when things were really at its most intense. At the time when the community was coming together, there was a small number of what I would describe as bad actors, as the commissioner did, who decided that they didn't want to be part of the community and help us with that. And so I think it would be unfair to those businesses that did cooperate to now reward those who didn't cooperate.
Yeah, and the only thing I would add is, no business likes to have a fine levied on them, but I want to compliment the mayor and the commissioner. Going back to the beginning of this, they set up working groups with different parts of the industries affected in Milwaukee. And I believe that it's actually some of the industry groups that reached out about the fines because, again, they were very concerned about employee safety and consumer confidence. And this is clearly a case where a few bad actors spoiled the barrel. And so they wanted to make sure that those who were not acting appropriately had some consequence. And I think the city has done a tremendous job in working with the business community to come up with an effective way to police those that were in danger of smearing the entire community.
Allison's final question states, businesses have been struggling in the pandemic. Can any of the businesses that were cited expect any kind of reprieve or reduction in these citations that were issued?
I don't think at this time, no.
Excellent. I believe those are the questions I am seeing in the chat. I'll give it just one more minute. Okay. Rose Schmidt with CBS 58 is wondering, what are your recommendations for unvaccinated people?
I'll start. I think the number one recommendation is get vaccinated. I think we'd probably all agree with that. If you don't feel comfortable getting vaccinated, talk to your physician, talk to your primary care doctor, talk to someone who you widely respect from the medical field, and ask them if they feel that you should get vaccinated. But if you're going to remain unvaccinated, wear a mask, protect those around you, even if you don't want to protect yourself.
I think we all want to chime in on this one because this is sort of the $1 million question now, and one of the last questions that remains. I think we should all take pride. And the county executive and I were at an event this morning for Pride Fest and Pride Month here in Milwaukee, but that was geared to the LGBT plus community, and we wanted to make sure that we were supportive of that community. But I think we should all take pride in our city. I think over the last 15, 16 months, both in the city and throughout the county, I think you saw a tremendous amount of people working together for the greater good. And it's reassuring to me, I know it's reassuring to the county executive and everybody else on this call, to see literally hundreds of thousands of people working to achieve the greater good. And I'd say for those individuals who, for whatever reason, have chosen up to this point not to get it, there's still an opportunity to do something for the greater good. And I know there were a lot of people, and this is human nature, who are going to say, well, I'm not so sure it's effective. I'm not so sure it's safe. Well, now after literally a half a year of this, we know not only is it effective, it's very, very safe. And it is without a doubt what has driven down the numbers and allowed us to get to where we are today. So we want you to be part of this. We want you, for yourself, for your parents, for your grandparents, for people you love, but for the greater good, take a shot. Take a shot. It's not going to hurt, and it's for everyone.
Absolutely. And I would just add on, I would recommend that you get vaccinated. And again, if you want more information, visit healthymke.com. But as you begin to enjoy life, and hopefully you are wearing a mask and you're letting folks know that you are unvaccinated. I think it's extremely important that folks are transparent. You have every right not to take the vaccine if that's how you feel. But it's important not to put everybody else in harm's way. So I think it's important that we be as transparent as possible, but get the shot.
I'm seeing our health officials not as well. Our final question that I'm seeing in the chat is from Patrick Polantonio with WISN 12. He says, Commissioner Johnson, what threshold will you look at to potentially reimpose restrictions should the city's numbers swing in the wrong direction?
Thank you. So I'm going to go back to the previous question as well. So my one recommendation would be to be vaccinated. So go get vaccinated, talk to someone you know and love about being vaccinated, call your primary care provider or somebody you trust to get information. And then when you're comfortable to be vaccinated. And if you're not, please wear a mask when you're in public. I think that's out of respect for others and to protect others around you. So the threshold that I would potentially consider, I really think we need to see a sustained increase in the number of cases. So we need to see that burden number continue to rise. So more than just a blip, I would have to see a sustained increase. We'd have to see a sustained increase in our testing positivity. So again, that's significantly lower than it's been throughout the entire pandemic. And then finally, I think we would have to see an increased number of hospitalizations. So we would look at all of that data collectively, and it would have to be headed in the wrong direction for more than a week or two for us to react. I think we're going to continue to see these blips over the course of the next few months. I'm really hopeful that we don't see that we don't reverse the direction we're going in right now. But at the same time, this virus is here with us. It's going to be endemic. We're going to continue to see cases in our city, and we should expect that. But again, it would have to be a sustained increase to reimpose restrictions.
Thank you, Commissioner. I see another question coming through from Allison Durr with the Milwaukee Journal-Sentinel. How do you feel the day has been going without orders so far? Are you seeing masking at a comfortable level?
So I'm going to assume this question is for me, and I have been in my office since 7 o'clock this morning, so I have not seen what's happening outside these doors or these windows. So I can't really speak to that, but I saw this weekend, even outside of the city of Milwaukee, people were masked in public spaces where there were a large number of people gathering. Again, I think it's really up to individuals and to those who are unvaccinated to continue to wear their masks.
All right. Those appear to be all of the questions. I want to give a special thank you to Tim Sheehy for joining us today. And thank you to all of our principals for being here. That concludes today's briefing, and we will be here on Thursday. Thank you.
Thank you all.
Thank you.
Thanks, everybody.
Thank you.